Hi, I'm Lisa Squire, Senior Communications Advisor with Alberta Health Services, and this is Health Matters. Today we're going to be talking with Taryn Neva, and Taryn is a health promotion facilitator with addiction and mental health with Alberta Health Services. And we're going to be talking about an important topic, a topic that can be a bit difficult to have a conversation about. We're going to be talking about suicide prevention. So welcome, Taryn.
Thank you.
If you think that somebody might be suicidal, what should a person do?
Well, really, probably the biggest thing is to know what those risk factors are and what the warning signs are for someone who might be suicidal. So some of the warning signs might be things like they are feeling very helpless. They might say things like, "I can't go on," or "It's not worth doing this anymore." Things like they maybe have lost interest in school or work or some kind of activity that they really liked to do. They may start isolating themselves from the things that they used to do or from family and friends. So those are some of the warning signs that you might wanna look out for. And if someone is you're concerned about someone who may be suicidal, the biggest thing to do is to support them. So to sort of start that line of communication and have a discussion with them about um, what that looks like for them, and certainly asking the question. And you might say something like, you seem really down, or you seem really blue, or you seem out of sorts lately. And so I'm just wondering if you are thinking about suicide.
And what should you do if you are concerned about a family member, but they've warned you that if you say anything to anybody, that they're definitely going to do something to harm themselves? What can a person do in that situation?
Mhm. And that's really not an uncommon response because of the taboo of suicide. And, we've had centuries of where suicide is a taboo. And so that's sort of a natural response that people have. Again, just making it very comfortable for them. They've come to you, obviously, for some support and wanting some help. And so there is that element of trust that they have with you already. And chances are they are just looking for help. And truly, help is just a phone call away, especially in our area. We have a 1-800 suicide number, which is a crisis line. We have the mental health clinic as well as addiction services clinic. So those are all places that we can reach out to contact here in Medicine Hat and in Lethbridge if we're in need of help.
And what can you do? Like, how do you get somebody to talk and open up if they don't think it's going to help or they really don't want to?
Yeah, again, mostly because of the stigma and the taboo of suicide, but really taking the time to sit down with them, making sure that you're in a safe and secure environment, letting them know that you're there for them, and really that listening. We need to be sort of active listening with them and hearing their story. And it may be really tough to hear someone who is feeling very depressed, very hopeless. That's really tough to hear, but they need to be able to talk about that, and you need to be able to create sort of that safe environment with them. That communication piece for suicide prevention really is a key to helping that person get some help.
And when should you involve a suicide prevention center and how can those help?
Yeah, so like a phone call to, like I said, the Distress Center in Calgary, the 1-800 suicide, to our mental health clinic at 403-529-3500. Any of those numbers for a crisis line work. And those individuals who run the crisis line, who answer the phone on the other end, are trained with helping someone who is feeling suicidal. So they have the skills and the tools, the education and the training required to really help you. So they might walk you through and listen to your story, and they will probably offer you some resources. So resources in your area, sort of what the next steps can be, and where to go for help in your community.
So, are there any other resources that are available in the community? I know you've listed a number of them.
We do have the Regional Suicide Prevention Council, which is a group of local organizations or stakeholders that come together to meet. We meet once or twice a year, and we talk about suicide prevention in our community and what sort of projects that we can do to help sort of reduce the stigma of suicide and prevent suicide in our community. And so we've had a number of projects. World Suicide Prevention Day is in September, so look for activities that are coming up in your community. Look for posters and things like that that'll be going on in your community. As well as we also have a Facebook page, and it's called My Safe Book. It was created by the Regional Suicide Prevention Council, as well as a group of youth and teens from the Calgary area, and it's managed here locally. And it's really a Facebook page to talk about suicide prevention and bullying and what we can do about those in our community.
Great, Taryn. That's some great information, and thank you for providing those resources. So if you think that somebody out there might be in trouble, there's a number of resources that are out there, so please don't hesitate to get in contact with somebody and help somebody get that help. I'm Lisa Squires, and this is Health Matters.